contracting this disease.
That's right, especially colon cancer and some of those that I mentioned that were associated.
Now, when you look at cancer and you think in terms of persons who have not contracted that disease, what are some of the warning signs? If a person, for example, we know that with cardiovascular diseases, it's palpitation of the heart, and et cetera. But what are some of the things that a person might be able to identify as warning signs that if that person does not change his or her way, whether physically or dietary, or et cetera, that they are more inclined to contract cancer?
Okay, the American Cancer Society talks about a number of warning signs that may be helpful, and those are some of them are a cough that is persistent. There are many reasons for coughing. Obviously, you can have a cold, but one that is persistent and won't go away. And if you have bleeding from when you go to the bathroom or something, or blood in the stool, or if you have a thickening or a lump in the breast, or if you have a mole that is increasing in size and changing in color, and certainly if it bleeds, those are the kinds of factors. If you have some persistent pain or weight loss, and those are signs. I would like to say at this point, however, that it is often when these signs are developed, it may be late in the disease. So we would rather recommend that you follow the recommendations of groups and organizations such as the National Cancer Institute, the American Cancer Society, American Society of Radiology, American Gynecologic Society, and so forth, who tell women that when they're 18 years of age that they should have a pap smear, and they should have that at least annually if there's some abnormalities. If there are no abnormalities, then maybe every 3rd year, or at the discretion of that gynecologist, and who tells women that they should have a mammogram at 35 or 40 years of age, and then every other year following that, and then every year annually from 50 years on. And who tell individuals that they should, men, that they should have digital rectal examinations when they're 40 years of age and above, and annually, and those kinds of...
and so these are all sort of recognized warning signs of cancer that we should all be aware of.
And there are screening and early detection tools that are very helpful in trying to discover lesions at early stages when they are most curable. And that's when you get the beneficial effects. Unfortunately, blacks are discovered to have, their cancers are discovered in more often, discovered less often at limited stages compared to whites. And that's part of the reason for the poorer outcome that one sees in
other words, it's a matter of detection. And this is what they mean when they say early detection. It increases the possibility of being able to cure that cancer. Well, now let's look at some of the possibilities in terms of dealing with this disease. Now, we do know that when we talk about cancer, we're talking about a whole variety of diseases and whatnot. But is there a possibility of ever, and I'm sure there is, of finding a cure for, or do we simply look for specific cures to deal with specific cancers, lung cancer this time, and next time prostate, or what? What's the situation in reference to that?
We look for specific cures for specific cancers because they're different diseases. You're exactly right. And we do cure some cancers because the natural histories are different, the causes of them are different, and the diseases are different, and therefore we may have different agents which are more effective in one type of cancer as compared to the other. There are some cancers which are cured, for example, by chemotherapy or by one or two modalities along. Unfortunately, they're not the major cancers like lung cancer, but there's, there are tumors like Wilms tumor, which can be cured with chemotherapy, or chemotherapy and radiation therapy. The lymphocytic or lymphoblastic leukemia, which is seen in childhood, where about 70% of those children are now cured. All of those children used to die 30 years ago. And there are other kinds of tumors, lymphomas, Hodgkin's disease and so forth, where 70% of those patients, or 70, 80% of those patients are cured. Testicular cancer. All of those are examples. Moreover, because of different strategies which are utilized, such as the use of chemotherapy and surgery, radiation therapy together at a time when the disease is sort of early in stage, we can salvage and cure more people, such as with adjuvant, we would call it, the treatment with chemotherapy at the time that the person has their primary surgery or radiation therapy. That allows us to salvage and to cure more women by utilizing that strategy.
And so, Doctor, during these last 8 minutes that we have here, let's have you to perhaps talk to our audience about some things that we've not talked about that you feel to be very, very important in terms of dealing with this issue of cancer. And I know that a very, very important ingredient of that has to do with the AIDS crisis. Let's talk about, over these next few minutes, about the impact that AIDS is having upon the black population and how that fits into what you're doing in the Department of Oncology at Meharry Medical College.
Well, AIDS, of course, is caused by a virus, we call it HIV-1 as we know it, or HCLV-3, which is a retrovirus which infects a lymphocyte, a T lymphocyte, which is one of the white blood cells in the body, which is very important with regards to a component of immunity, which we call cellular immunity. And if you don't, of course, have the functioning of that, then you're open to all sorts of infections like tuberculosis and various parasitic infections and infections with abnormal organisms that usually don't infect normal people, such as pneumocystis carinii and so forth, that you have PCP pneumonia, those kinds of things. And those various fungal infections like cryptococcus and pneumonias and toxoplasmosis and things like that that cause people to have infections of the central nervous system, brains, and meningitis. So most of those patients die from infections because the body's immune system, which is the control mechanism against the invasion of abnormal organisms, the invasion of things that are not self. That's what the immune system does. But it also, as an adjunct to that, there are some cancers that are seen more commonly and recur as a result of this immunosuppression in these individuals. Like, for example, some lymphomas, high-grade non-Hodgkin's lymphomas are seen more commonly in those individuals. Kaposi sarcoma, which is a rather rare disorder, usually seen in older people, and sometimes we're seen in East Africa before the advent of this epidemic, which